Physicians and other healthcare providers use common terminology and references to document location in terms of human anatomy. We're going to take a few moments here and go over some of those directional terms as you prepare to take this medical assisting program and be familiar with some of these terms before you move into the different body systems. Let's talk about the definition of anatomy and physiology. Anatomy, by definition, is the study of structure. And we give an example here of the hand. The hand is made up of a palm and 5 fingers, and that is the structure of this hand. Physiology, on the other hand, is the study of the function of that body part. And the hand's function is to bend, and it's used to grasp. So the hand is structured in such a way so that it is able to function the way that it was built. Let's look at some of the directional terms. And when we talk about direction, we have to think about the body divided into different portions or parts. And when we look at planes, they are exactly what you see here, sort of imaginary lines or plates that divide the body into different sections. The first plane we want to talk about is the coronal plane, which divides the body into the front and back portions. The front portion is considered the anterior portion, and the back portion is considered posterior. And 2 other terms that are commonly used are ventral for the front and dorsal for the back. Another plane that divides the body into right and left sides is a sagittal plane. And if that plane happens to run right down the middle and divide the body into 2 even sides, it's considered the mid-sagittal. Another plane or dividing plate is the transverse body plane. And this is going to divide the body into top and bottom sections. The top section is called superior, and the bottom section is called inferior. And this isn't just at the human body as a whole, but any organ in the human body that we're talking about, when we're talking about areas of that body, of that organ, will be divided by these imaginary boards or these planes. We're talking about positioning. Again, another way to locate certain body parts is dependent upon what position the body is in. And if the body is laying in a prone position, it is laying face down on your abdomen, and a supine position is laying on your back, face up. And one easy way to remember that is supine is on your spine. So now that we've divided the body up into sections, let's talk a little bit about directional terms. And a lot of the divisions that we talk about is so that we can locate certain parts of the body or certain parts of a body organ. When we're looking at direction, if anything is headed toward the top or toward the head, it's considered superior, and things headed toward the feet or toward the bottom are considered inferior. When we're looking at the front and back, and remember, that's the coronal plane that divided the front and the back. Front is also considered anterior or ventral, and the back portions of a body or organ are considered posterior or dorsal. When we're looking at extremities, arms and legs, we look at them a little bit differently than we do as the body as a whole. And that is, we want to look at how they relate to the point of attachment. The closer something is to the point of attachment, it's considered proximal, and the further away it is considered distal. There are internal structures and there are external structures. Obviously, the internal structures are those that are found inside the body, such as your liver, your gallbladder, your heart, muscles. And those that are considered external structures would be your nose, your eyes, your ears. And another way to look at where we can find our body organs, we'll refer back to the video that we watched on body cavities. In this one here, we're looking at cranial and spinal cavities. The cranial cavity is going to contain your brain and your cranial nerves, and your spinal cavity will include your spine and your spinal nerves. Another body cavity that will hold a lot of your abdominal organs is the abdominal cavity. And it will include your stomach and intestines, your kidneys, your gallbladder, and some of your reproductive organs. And the pelvic cavity will include some intestines, your bladder, your rectum, and the rest of your reproductive organs. The thoracic or chest cavity will hold the mediastinum, and that's the central region of that thoracic cavity. And in there you will find your trachea, your esophagus, your heart, and your lungs. The last division we're going to look at here are our quadrants, and this really divides up the abdominal area of the body, and there are so many organs in this area that it really helps physician practitioners to be able to locate where someone is experiencing pain or where they might be having some discomfort. And so when we identify pain location in the abdominal area, we're going to use these quadrants. And they are very simply labeled the right and left side, and there are upper and lower quadrants on each one of those sides. This was a very short video lecture, and it's just to introduce you to the idea of location and direction and how you are going to be using some of these identifiers to help locate an area of the body to document for a physician or to help a patient understand what they might be experiencing. And I really would like to welcome you to Anatomy and Physiology and Medical Terminology, and enjoy your time learning and discovering all that you'll need to know to become a successful medical assistant.